Hello friends, I am Dr. Mithun, Biochemistry resident. I have come across so many queries about the biochemistry from the students, like how to study biochemistry, how to memorize the vast subject, or there are some students who are also complaining about, even though they are studying, they are putting a lot of hours for the study, they are not able to recollect the information which they have studied. So I am here to help with those questions, and hopefully I will be able to answer all those queries that students have. In this video, we will cover a lot of things like which textbooks we need to use, or there are available textbooks which you can use for the study for the biochemistry, and how to approach the study, how to approach the biochemistry so that you can learn it effectively and you can memorize, or you can recall the information that you are studying for more effectively for longer time. So let's get started. We will first talk about the textbooks. There are a lot of textbooks available for the biochemistry, okay? But in Indian scenario, as you see, the most commonly used textbooks by the Indian medical students are Satyanarayana and Vasudeva. Why those books are preferred? Because of their easy language, summarized chapters, and understanding for the topics. And you get the idea of concepts from there. Okay. The difference between Satyanarayana and Vasudeva is that Satyanarayana have the information very concise, very brief, and the information is kind of little. As compared to Satyanarayana, Vasudevan have more information, and the conceptual wise, Vasudevan is better than the Satyanarayana. Okay, so student can start with either of the books, Satyanarayana or Vasudevan. It's up to you guys to make a choice. What you have to do is you have to get the first reading from Satyanarayana or Vasudevan. You start with Satyanarayana or Vasudevan. Okay, and as you take your first reading, if you are into the note taking, then take the notes of important info. As I said earlier, the concepts are better given in Vasudeva. Coming to the foreign author books, there are two commonly used foreign author books, that is Harper's Illustrated Biochemistry or Lippincott Biochemistry. Okay, those comparatively, those both books have the similar information. I would suggest that both books are same. Want to read from the Harper, first you should finish your first reading from Satyanarayana or Vasudevan, so that you can get little bit familiar with the concepts, and then you go to Harper to make your concepts strong. Because Harper is a book which have lengthy chapters, which is have a little bit difficult language as compared to Satyanarayana or Vasudevan. Rather than that, you will make your concepts more stronger, and you will make your understanding more deepen. The thing is that to study the Harper, you need a lot of time. So after first reading, if you think that you can have a time, and if you want, just go for particular topics. While studying Harper, just take the notes of important points from there and add those points to your Satyanarayana or Vasudevan's textbook itself. Or if you have taken the notes from Satyanarayana, just add those important notes from the Harper or Lippincott to your notes. Leave aside the Harper. Okay, don't ever touch that book. The main concept here is stick with the one textbook. Keep adding notes if you getting new information from lectures, from classes, or from other any textbooks which will you think that will be helpful for the future. So we'll see now how to study general biochemistry. So first foremost, start first reading with your standard textbooks, those I have mentioned earlier before. Then next step is make a notes in your own words. For that, you can use iPad, or you can make notes handwritten. Okay. Then third point is add important points from NEET PG notes. I will suggest that Dr. Rebecca James biochemistry NEET PG notes are perfect, and they are very concise and very conceptual. Okay, so those notes you can prefer, or you can see my videos, take notes from that. Fourth point that is very important: make charts whenever necessary. So in general biochemistry, as you see, there are more
topics which are related to classification, like classification of carbohydrates and proteins and fats and all those things. Then there are some mechanisms, okay, like competitive inhibition of enzyme and all those things. So you have to make the charts for this, and those charts you have to stick on the wall in front of your desk or in front of your study table, so that whenever you come in contact or whenever you see those charts, you will just give time a little bit, a minute or two, to revise it. Okay, and then the flow of time, every time whenever you see those charts, you revise it, and that will a habit of studying those topics very easier. In less time studying these topics, and you will have nice output. Okay, so which topics we are talking about in general biochemistry that you can make a chart of? Okay, there are topics like classification of carbohydrates, classification of lipids, classification of proteins, classification of amino acids, classification of enzymes, then structure of proteins, structure of DNA, enzyme inhibition, the graphs which are competitive, non-competitive. Okay, those graphs, the vitamins and the hormones. For these all topics, these are all important topics which covers like almost all general biochemistry. So you can make a charts for these all topics and stick it in front of your desk on the wall, and you can revise it every day. That will help you to get this topic done more efficiently and more fast. Coming to metabolism, my videos, then draw it while watching the videos, draw it, so you will get the idea what contents are there in that metabolism schematic or the cycle, and then draw it without reading the text. Then after drawing that, you assess the uh, mistakes you have made, or the then after that you read that whole metabolic cycle from the textbook, that is standard textbook, or you can just watch my videos. Okay, then after that you try to redraw it. You redraw it with proper labeling and with different colors. Like you can use two or three colors, not more than that. For example, you can use one color for substrate. Those are intermediates. Those are forming in in the reaction, and you can use other color for the enzymes. Those are used. Okay, so like this. Then you draw it with proper labeling. Then what you have to do, you have to stick that drawing in front of your desk or your study table, and whenever you are looking, whenever you are entering your room, or whenever you are sitting for study, or whenever you are passing by in front of that wall, you have to review it every day. Okay, after reviewing, you have to redraw it. Try to redraw it. Only way to do the metabolism, only way to do the to study the metabolism is to redrawing all the metabolism with proper level. Understand the cycle more efficiently, and you will able to remember, recall it in the exams. So you have glycolysis, then Rappaport Lubering cycle, Foris cycle, gluconeogenesis, glycogenesis, glycogenolysis. Then we have triacetyl carboxylic cycle. Then we have electron transport chain. Then we have shuttle systems. Then we have HMP shunt. Then we have fatty acid oxidation, fatty acid synthesis, cholesterol synthesis, fructose metabolism, ketogenesis, then heme synthesis. Then in genetics we have DNA replication, DNA repair, transcription, translation, cell cycle, and lastly lac opera. So make all these charts, stick them to you on the wall in front of your study table, review them every day, and redraw them every day. The effective way to learn the metabolism, so that you can recall those, and you can memorize the metabolism or understand the metabolism better. Now coming to test and diseases. For the test, you have to make a tables. Okay, so first column will be name of the test. Then second column will be correlation, to correlate that test with the clinical aspect. So what is the use of this test, in which diseases or in which pathology we are going to use, or we are going to do the test. The next column will be when when that particular test is performed. You have to make this chart for the tests, and just study this every day, and you will be fine. What about the diseases? Diseases, there are not a lot of diseases right now in first year. In biochemistry, there you will come across some diseases which have biochemical pathophysiology. So that diseases you have to learn. For that, just make a table with column, first column for the etiology, which is the causes of the disease. Second column will be for pathogenesis and the clinical picture with it. So biochemical pathogenesis with clinical picture, and the third column you make for the diagnostic test, which are the diagnostic biochemical tests we perform for that particular disease, and little bit about the treatment. So you make the tables for this test and diseases. You take a look at it every day, just revise it every day, give 5 to 10 minutes or 15 minutes maybe, and you will save a lot of time, and you will be efficient. So coming to last part, that is technical biochemistry, which consists of a lot of technical procedures which we perform in a biochemistry lab, okay, which are used for the testing of the samples which are collected from the patients. Okay, this test includes like chromatography, electrophoresis, ELISA, calorimetry, spectrophotometry, DNA isolation, pH meter, or centrifugation. Okay, so how to go with these topics for the biochemistry? So take notes from the practical classes. First of all, attend all practical classes. Be attentive in the practical classes, and the demonstration of practical classes which are taken before the practicals, that is very important. You have to make notes in that demonstration class, or you can watch my videos. Then there are some important points that you have to uh, make a note of. There are classification of this procedure. Okay, then there is a principle which is very important. You have to understand the principle on which this or the procedure is performed, and the application of the particular process or particular test which is done, like chromatography. If you take an example of chromatography, you have classification of chromatography. There are gas chromatography and there is liquid chromatography. Then there is other classification, subclassified those gas and liquid chromatography. Then there is a principle, and on what principle the chromatography acts. Okay, it works on what principle, that you have to know. And the application of chromatography, application where the chromatography testing or the method is used, for which kind of disease or which kind of sample you are going to use chromatography. So this kind of information, only this kind of information is enough for the first year MBBS, I think so. So finally, we will summarize what we have talked about. So textbooks, which textbook should I choose? That is, I have given you the choice, Satyanarayana Vasudevan. Okay, start with those. Then identify the important topics and the concept from the book, and focus on that topics particularly. Then organization, take notes in proper way. Then the summarize the info. You have to make the notes in your own words that you can understand and you can tell others, or you can teach others. Okay, and then the correlate the information clinically. That is the clinical aspect of biochemistry that you have to take into consideration. So I hope that I have tried to give the answers to your queries about how to study biochemistry, how to memorize it, and I hope that this information will be helpful for your future study. That's it for today's video. Video will at least give you some idea how to study biochemistry, and this will be very helpful for your future study. See you next time.